Let's do some health now. An electronic health project to be launched by government is among others expected to reduce the cases of financial impropriety plaguing claims of payment at the National Health Insurance Authority. The providers of the scheme will also be hooked onto one platform following the smooth rollout. Minister of Communications Esla Owusu-Ekufo made the disclosure at the launch of the Wala app aimed at assisting blood donation in Ghana.
The Wala application, newly developed and launched by two Ghanaians, Dr. Daniel Addo and Randolph Owusu, will be a go-to source of blood donation information to aid the blood service reach out to as many Ghanaians to voluntarily donate blood to save lives. Developers of the app say the health app is a stopgap measure in reducing deaths resulting from unavailability of blood at the National Blood Bank.
The blood service is always in the news saying we need blood at 37, we need blood at Kolebu. But now with Wala, we are going to demystify the misinformation in the public about blood donation. Now people will be comfortable to donate blood. And with all the social sharing features we have in the app, now social media is even going to play a bigger role because everybody is on WhatsApp and Facebook. And Wala is giving you the chance to be able to tell the world you've donated blood, and as well we increase the blood bank's stock because of the blood donations. We have a short code where if you don't have access to internet or a smartphone and you just have a mobile phone with any cell signal, you can dial *711 *117 hash, *711 hash, *117 hash. You see, so we have this short code that you don't need any internet access. You just go on it and you learn more about blood donation. You even find contact details of the call center that has been set up at the National Blood Service.
Ministry of Communication is also a partner. You know, they've declared their goal to ensure that they are empowering Ghanaians and the Ghanaian youth to develop the app. And as you heard from the Minister of Communication, he wants to support apps like Wala to do more. I mean, even the first app we came out, which is called Bisa, is being used even more in other countries, including South Africa, even more than Ghana. So I think it's high time we get corporate bodies, got the institutions and government supporting young Ghanaians. If Ghanaians are supported and empowered, we can do more.
Wife of the Vice President, Samira Baumia, believes Ghana will only achieve the WHO 2020 target of 100% voluntary blood donation if Ghanaians take blood donation a lot more seriously.
We need to move away from the system of family replacement and paid donors in order to meet the World Health Organization target of 100% voluntary donation by 2020. The government, through the Ministry of Health, is highly committed to this initiative. Together, we can make this happen. Together, we can save lives. As we've heard from the app developers as well, there's also additional information we can get about lifestyle choices and health information. I would like to urge all and encourage us all to download and use this Wala Health app. Let us all accept blood donation as a civic responsibility and a duty to society. With sustained efforts, we shall accomplish our goals.
Meanwhile, Minister for Communications Esla Owusu-Ekufo advised app developers engaged in the digitization process to come up with apps tailored towards the needs of the users.
If government buys the applications developed by our local talent and assist them economically and financially as well, that is when they can also continue to innovate and continue to develop wonderful applications that will meet our needs. I also made the point that the national ID, which is going to be rolled out sometime this month, is also developed by a local firm. We are also determined to digitize all the processes in the delivery of health services in this country. And so this will be one very key component that can be added to the suite that we're looking at in the e-health applications being developed jointly within the Ministry of Communications and the Ministry of Health. All this story about the fraud in the National Health Insurance Scheme can also be reduced because even sitting at the National Health Insurance, they can see exactly what the doctor has done, what medicines have been prescribed, what procedures have been undertaken. And so if you're putting in your claim, it's easy for them to cross-check on the digital platform to see exactly what has been done. And it will also minimize corruption in that sector. The pharmacists also cannot inflate the prices of the drugs that he's dispensing, because on that same application, it should be possible to see the various drugs available for you so that you don't have to buy the most expensive proprietary drug, and that the pharmacist can also not put in a claim for drugs he didn't dispense, because what he actually dispensed would be visible to everybody.
The Wala app can be used by all mobile phone users. It also provides general information on living healthy lifestyles. Government's negotiation with the World Bank for a facility to implement the e-health project so far, according to the minister, is on course to ensure corruption and the human interface with health service delivery are significantly reduced.
So once you're logged into the platform, it takes a few seconds. We give you a user agreement because it's very important. We tell you what you're using your information for. So you have to agree to that. And the first key thing on the platform is we get your location data. So we have access to Asasi GPS. So we've integrated it. So based on your location, we'll be able to recommend